The U.S. government has been heavily criticized for the lack of COVID-19 testing kits. But there are fears the U.S. may soon lack other crucial supplies. Nick Harper reports from Washington.
In the age of global trade, the United States has come to rely heavily on other countries for the raw materials to make simple and essential medicines. Ingredients are regularly imported from China and India and made into drugs in the US. It's an issue health officials have warned about in Capitol Hill briefings.
What we're finding now is that in many cases, China was the only supplier of these raw ingredients. And so what we've identified through this episode is a critical choke point in the supply chain for pharmaceuticals and some critical pharmaceuticals.
The threats to global health and the health of the American people are evolving.
The Center for Strategic and International Studies in Washington, D.C. published a report in November looking at the U.S. preparedness before the emergence of the COVID-19 pandemic. One of the report's authors sees difficulties in the creation of an autonomous pharmaceutical industry. Simply decoupling
Our pharmaceutical industry from China is not going to be a simple or cost-free solution. If we were to decouple ourselves in the biopharmaceutical industry from China and decide we're going to be wholly self-sufficient, we would need a 10-year strategy of investing in infrastructure.
The authors have warned on Capitol Hill that the U.S. government is not properly prepared. They argue that successive administrations have been stuck in a cycle of crisis and complacency, that they deal with the immediate effects of an epidemic, but then cut funding and services when the crisis dies down. The Trump administration disbanded the National Security Council's Epidemic Task Force 2 years ago in 2018. It's still not clear how much the supply chain disruption in China will impact America's ability to get essential medicine. But experts say planning for the next epidemic needs to begin well before the next crisis hits. Nick Harper, CNA, Washington.